Hello everyone and welcome. This is Martha from Dental Brush-Ups, and today I'm going to be teaching you about the cranial bones. Now there are 8 cranial bones or bones of the brain case, and they include the frontal bone, which is located right here on the forehead region, the parietal bones, which are paired, and you have 2 of them, one on either side of the skull. You have also the temporal bones, which are located on the sides of the skull, and they are paired. And we also have the occipital bone, which is located right on the back of the head of the skull. Now, you also have the ethmoid bone, which is located right here, right behind the lacrimal bone. And we also have the sphenoid bone, which can also be seen on the sides of the skull. This is part of the greater wing of the sphenoid bone. So we're going to explore each one of these bones individually. Now let's talk about some frontal bone facts. Now, this bone, the frontal bone, is responsible for forming the forehead, and it also contains the frontal sinuses, which are air-filled cavities, and it articulates with the paired parietal bones on either side to form what's known as the coronal suture right around here. Okay, and it also articulates with many facial and cranial bones, and it forms the supraorbital margin, which is right around the ridge here of the brow on either side. And it also contains the supraorbital foramen, which is a small little opening that's right around this region here on either side of the brow. And this is an opening for sensory nerve that goes to the forehead. Now let's take a look at some parietal bone facts. The parietal bones obviously are paired, right, on both sides of the skull, and they make up a large part of the sides of the cranium, as you can see the massive size, right? And they also articulate to form the coronal suture, which is right around here, the sagittal suture, which is right down the dead center of the skull, the squamosal suture, which is right around the area of the temporal bone, and the lambdoidal suture, which is the one that borders the occipital bone in the back. Now let's take a look at some temporal bone facts. So the temporal bone is paired. It's located on either side of the skull, forming the lateral sides of the skull. Now, this bone articulates with the zygomatic bone, which is located right here. It also articulates with the parietal bones, which are paired bones on either side of the skull. It also articulates with the sphenoid bone, which you can see right here in orange, and the occipital bone, which is right back here. Now, this bone is divided into 3 different regions. It's divided into the squamous region, which is this larger portion up here that also contains part of the zygomatic arch here. And it also has the tympanic region, which forms most of the acoustic meatus. Okay, so this is connected kind of to your ear area. And it has also the petrous part, which contains the mastoid process that you can see right here, which serves as an area for the sternocleidomastoid muscle attachment. Now let's take a closer look at some occipital bone facts. The occipital bone makes up the posterior portion of the skull, and it articulates with the paired parietal bones and the paired temporal bones on either side, as well as the sphenoid bone, which is located in this under portion here. Now, this bone is also responsible for forming what's known as the foramen magnum, which is this large opening here, which serves as a passage for the spinal cord as it exits the skull. Now, it also has 2 jugular notches, and both jugular notches on the occipital bone and temporal bone make up what's known as the jugular foramen. Now, it also has two paired hypoglossal canals, which are canals that are located in this little area here on both sides. And these are just openings for cranial nerve number 12, which is also known as a hypoglossal nerve, which is an efferent nerve for the tongue musculature. And it also has two occipital condyles, which are located in this lower portion here of the skull. And these form a movable articulation with the atlas. So that way you get some articulation that way as well. Now, if you take a closer look at the posterior portion of the skull, you'll see the small bony projection here, which is known as the external occipital protuberance. This bony projection acts as an attachment site for the ligamentum nuchae and the trapezius muscle. Now, if you take a closer look, here we have the supreme, the superior, and the inferior nuchal lines. And these serve as the most superior part where the muscles of the head and neck attach. Now let's take a look at some ethmoid bone facts. So the ethmoid bone, you can see that it is very difficult to see unless I take the skull apart. So we're going to be taking that apart and showing you the parts of the ethmoid bone. Now let's take a look at some ethmoid bone facts. Here with me, I have the ethmoid bone. I actually took the skull apart so that you can see the size of it compared to the other cranial bones that we were just talking about. But if you take a closer look at the image down here, you can get a better view of this bone. And this bone forms the base of the cranium and the orbits. Now, it also contains what's known as the ethmoid sinuses. And if you take a closer look down here, you see these little perforations. Those are known as the cribriform plate. And those allow for passage of the olfactory nerves, which are the nerves that are responsible for your sense of smell. So now it also has this little bony projection here known as the crista galli, and that serves as an attachment for the meninges of the brain. And also down here in this section, you can see the perpendicular plate. So the perpendicular plate forms the nasal septum. Now, the superior and inferior nasal concha that you see over here, okay, the superior and inferior nasal concha increases the surface areas for your respiratory epithelium. So this is a very important bone. Now let's take a closer look at some sphenoid bone facts. Here with me, I have the sphenoid bone. I actually took it apart from the rest of the skull so that you can see what it looks like. And it almost kind of resembles like a little bat. It has a little bat-like appearance to it. And this is a very important bone because it joins pretty much almost every other bone in the skull. And it contains what's known as the sphenoid sinuses. So up here on the image, you can see the location of these sphenoid sinuses, but you can also take a closer look down here and see on the image where those sinuses are located on this frontal portion of your face. And it also has this area known as the sella turcica, which is located right in here, and that is where the pituitary gland sits. So that's a very important anatomical landmark. Also, over here, you can see the medial pterygoid plate, which is located right here, and that forms the lateral walls of the nasal cavity. And right behind it, you can see the lateral pterygoid plate, which serves as an attachment for important muscles of mastication. Now, over here, you have the greater wing of the sphenoid bone. So this is what it looks like, the greater wing, right? And this one forms the anterior floor of the middle cranial fossa. Now, you also can see the lesser wing of the sphenoid bone located right here. The body of the sphenoid bone is right down in the center. And you can also see the anatomical location of the optic canal, the superior orbital fissure, the foramen rotundum, the foraminal valley, the foramen spinosum, and these are most of the things that make up the sphenoid bone. So now I hope you enjoyed this video, and if you like this video, please make sure to like, share, and subscribe, and make sure you stay tuned for more.